Part of my role, I run the AI in Health and Social Care Award, which is a £123 million grant and support programme to support AI adoption. The rationale for that programme was we needed to prove that solutions that worked in the lab worked in real world practice and worked in the pathways in the NHS into which they're going to be delivered. And we're really proud to say that through the award, which is now well into its sort of third year, we've got examples of how pathways are being transformed with AI. We see it in lung cancer screening, we see it in stroke, and we're seeing it increasingly in areas like skin cancer diagnosis. So that's the barrier. We hope the award is kind of changing it, and we're starting to see solutions become mainstream. There's huge value in events like this. The community is small but broad, and the range of perspectives here are really interesting and kind of challenge the thinking of policymakers like those in my position. I think from a kind of policymaker's perspective, we get really open and honest feedback about what is it in the research through to adoption innovation pathway that works well and what doesn't. And that allows us to go and think about the policy levers we can use to improve the experience. For example, thinking about how to make procurement and commercial negotiation easier at the mature end, but also how we can create better access to data for researchers looking to build data-driven machine learning models that require large volumes of training data. So the sessions like this really allow us to hear unfiltered, honest feedback. And I think for other participants, there'll be a huge range of commercial opportunities to connect with potential collaborators, as well as to interact with policymakers like myself. I think there's a wide range of applications of AI or kind of machine learning solutions in healthcare. The area that I can highlight is the sort of use of machine learning models in radiology-based diagnostics and thinking about the interpretation of images. It's one of the kind of categories that we funded quite deeply through the AI award, and it's a category where we're seeing the adoption and spread of solutions more prominently than in other areas. But having said that, there's also a kind of huge opportunity for machine learning solutions in the digitization and automation of operational tasks, the applications in population health and in predictalytics. So we think there's a lot of problems to which machine learning solutions are suited. And I'm particularly excited about the frontier in the radiology space, because I think there's going to be a lot of change and a lot of evolution of services in the coming 1 to 2 years. So I'm Dan Bamford. I'm a Deputy Director in NHS England's Innovation Research Life Sciences team, where I look after our medtech and digital portfolio. I've been in the NHS for 9 years now. And I've worked sort of in operational roles during that time, and also consulting to the service on the kind of transformation of services. For the last 3 years, I've been in the Innovation Research Life Sciences team, working with AI solutions and vendors a lot, but also thinking about the broader health tech pathway and how to make it more effective for innovators who use it and for the patients who benefit from service change at the end of it.